one of the things that can happen after a facelift is a fluid collection. And so Jan just had a fluid collection. So I'm going to take you through kind of what we do about this. Now, each one is going to be a little bit different. What you need to do about a fluid collection is typically in surgery, we say that if a fluid collection happens in the first 24 hours after surgery, probably something maybe that the surgeon could have cauterized or sealed a little bit better. But if it happens beyond that point, maybe something the patient could have done better, or sometimes they're unavoidable. In our situation today, our patient was doing some laundry and then noticed some swelling of one side of the face immediately after. And so this is a problem that I'm honestly seeing more and more and more, is our patients feel so good after surgery that it doesn't keep them down. And so they do things around the house, but they do things maybe that they shouldn't do. Normally, you kind of feel like poop after surgery. And so that keeps you on the couch, keeps you in bed, keeps you from exerting yourself. But if you don't feel like poop, then you go do the things because you're at home and you're able to catch up on some things. Well, try not to do that. We've had a couple patients lately who have done that, and they get a fluid collection. This one happened, I think, on day 3 or 4 or so. And so we put a little drain in, and so you'll be able to see a little bit of how we manage it right here.
All right. We are here 7 days post-procedure. We had the deep plane facelift, the deep plane neck lift, and the lip lift. Awesome. How has everything been since we last spoke?
It's been good. I'm in no pain now. I'm just, tight. Everything's tight and of course swollen some. But no, I've done good. It's had a little complication with some fluid here that we've had to aspirate for several days. But other than that, it's been good.
Yeah, everything's been awesome. That's good. Has Dr. Robb been pretty responsive when it comes to...
Oh my gosh. He met me Saturday from his lake house. He came up here and worked on aspirated or whatever you call it, the fluid out. And then he came back on Sunday, yesterday, and met my husband and me again. He did it again. Wow. So he's been he's been great.
Yeah.
Really, really attentive to any little problem, but he said it's not really a setback because I'm still doing good. The sutures came out today, so the sutures said that's good.
Awesome. I'm happy to hear that. It's been good draining all that fluid and getting you set up for healing. So awesome. Yeah. Awesome. What's maybe a piece of advice you would give to someone who wants to do something like this?
Just make sure that it's something you decide that you want to do for yourself and not for anybody else. And just realize that it's going to take time, and you're going to want to be secluded afterwards for a while. Like a week it's going to take before you really are going to be wanting to go out. Yeah. And it just takes time. But it's worth it, but you have to do it for you. And of course. Nobody else, it has to be the right time for you.
Absolutely. I think that's great advice. Yeah. Make sure it's something that will make you happy, right?
Right.
Exactly. Awesome. Well, you're looking great.
Thank you.
And thank you so much for sharing. We're excited to talk soon. And thank you.